Hey there! Did you know your heart has a hidden gatekeeper that decides how blood flows into your lungs? Most people have never even heard of the pulmonary valve at S, one of the most important structures keeping you alive. Today we're going to talk about exactly what it does and what happens when it stops working properly. Stick around until the end because I am going to share some surprising facts about this tiny but mighty valve. The pulmonary valve is a one-way door between the right ventricle and the pulmonary artery. The pulmonary artery is one of the largest blood vessels in your body, and it carries oxygen-poor blood from the right ventricle to your lungs. Now, here's a very important detail. Your heart has 4 chambers, 2 on the left side and 2 on the right side. The right side of your heart pumps blood to your lungs, and the left side of your heart pumps blood to the rest of your body. So, if you're standing upright, the pulmonary valve is at the top of your heart. Between the top right chamber called the right ventricle and the main artery leaving that chamber, the pulmonary artery. Now, the job of the pulmonary valve is to make sure that blood flows in only one direction into the pulmonary artery. It opens when the right ventricle contracts and pushes blood out to the lungs, but it closes tightly when the heart relaxes. Think of the pulmonary valve like a traffic light. When it's green, which means go, blood can flow through. But when it turns red, meaning stop, the valve shuts and blood can't leak back. This is essential because we want blood to go to the lungs to pick up oxygen and then return to the heart before being pumped out to the rest of the body. And we don't want blood leaking backwards. Now, the pulmonary valve has 3 flaps or leaflets that are connected to each other like a party blower. When the right ventricle contracts, those leaflets open up like a door and blood can pass through. When the right ventricle relaxes, the leaflets close tightly to stop the flow of blood and prevent it from leaking back. This happens over and over again with every heartbeat throughout your life. Pulmonary valve problems usually cause symptoms like fatigue, shortness of breath, and chest pain. Sometimes people may also feel dizzy or even faint. If someone has a pulmonary valve disorder, their lips or fingers may even turn blue because there isn't enough oxygen in the blood. It's really important to get help right away if these symptoms happen. Early diagnosis and treatment can make a huge difference. There are 2 main types of pulmonary valve disorders, stenosis and regurgitation. In pulmonary stenosis, the valve leaflets are narrowed, making it harder for blood to flow through to the lungs. This means the heart has to work harder to pump blood, which can make it bigger over time. People with pulmonary stenosis might feel tired or short of breath, especially when they're doing something that requires extra effort, like climbing the stairs. In pulmonary valve regurgitation, blood leaks backward into the right ventricle. This happens when the valve leaflets don't close tightly. A leaky valve means that the heart has to pump more blood than it needs to. Over time, this can make the heart muscle weaker. People with pulmonary valve regurgitation may feel like they can't catch their breath, especially when they're lying down. They might also experience a fluttering feeling in their chest. Pulmonary valve stenosis is when the valve leaflets become stiff and narrowed. This makes it harder for blood to flow into the pulmonary artery. The most common symptom is shortness of breath, especially during exercise. You might also feel tired or weak all over. In severe cases, the right side of the heart can get bigger because it's trying so hard to pump blood. This is called right heart failure. Pulmonary valve regurgitation is when the valve leaflets don't close properly. This lets blood leak back into the right ventricle. You might feel like you can't catch your breath, especially when you're lying down. The right side of the heart might get bigger over time because it has to pump more blood than it needs to. The blood that leaks back into the ventricle can also make it harder for the heart to pump blood out to the lungs. This is called pulmonary hypertension. Both pulmonary stenosis and pulmonary regurgitation can be serious conditions. It is important to see a doctor if you have symptoms that could mean you have a problem with your pulmonary valve. Early diagnosis and treatment can make a big difference. So what causes pulmonary valve problems? Well, sometimes people are born with a valve that isn't the right shape or size. This is called a congenital heart defect. Other times, the valve gets damaged by rheumatic fever or an infection of the heart. But many times, we don't know exactly what causes the problem. It is also important to know about risk factors that could increase your chances of developing a pulmonary valve disorder. For example, having a family history of valve problems, or having uncontrolled high blood pressure, or even obesity can put a strain on the heart and valves over time. These factors don't mean you'll definitely develop a problem. But it's good to be aware of them and take steps to keep your heart healthy. When you visit your doctor, they'll ask you about your symptoms and do a physical exam. They might listen for a heart murmur, which is an extra sound that can happen when blood is flowing through a leaky valve. There are a few tests that can help diagnose pulmonary valve problems. An echocardiogram uses sound waves to create images of your heart. It's a great way to see if the valve is working properly. An MRI takes detailed pictures of your heart and blood vessels using magnets and radio waves. A cardiac catheterization is a procedure where a thin, flexible tube is inserted into a blood vessel and guided to your heart. This test can give doctors important information about the blood flow through your valve. If you have a pulmonary valve disorder, your doctor will work with you to create a treatment plan that's best for you. The goal is to improve your symptoms and keep your heart as healthy as possible. One of the most common treatments for pulmonary stenosis is a procedure called balloon valvuloplasty. During this procedure, a thin, flexible tube with a small balloon at the end is inserted into your blood vessels and guided to the pulmonary valve. When the balloon reaches the valve, it's inflated to open up the narrow passage and allow blood to flow more easily. This helps reduce the workload on the right ventricle and can relieve symptoms like shortness of breath and fatigue. In some cases, surgery might be needed to repair or replace the pulmonary valve. If the valve is severely damaged or can't be fixed with a balloon procedure, a new valve can be surgically implanted. These valves can be made from animal tissue or mechanical parts. Advances in medicine have led to less invasive ways to repair or replace the pulmonary valve. Some procedures can be done using small incisions or through blood vessels, which means less pain and a faster recovery time for patients. Overall, the pulmonary valve is a vital part of our cardiovascular system, ensuring that blood flows efficiently to our lungs to receive oxygen. Understanding its function, common disorders, and available treatments can help individuals make informed decisions about their health and seek timely medical attention when necessary. By staying informed and proactive, we can all play a part in keeping our hearts healthy and ensuring proper blood circulation for a better quality of life. The pulmonary valve is like the guardian of lung circulation, silently working to keep blood flowing smoothly. But just like any vigilant protector, it needs our attention and care. Ignoring early warning signs or living with undiagnosed symptoms can lead to more serious complications down the road. So if you notice any unusual symptoms or have concerns about your heart health, don't hesitate to speak up. Listen to your heart, literally. If it's trying to tell you something, seek medical help early. Remember, knowledge is power, and your heart deserves all the knowledge you can get. Thanks for watching. If you enjoyed this video, please give it a thumbs up and share it with your friends. Subscribe to our channel for more health animations. And if you have any questions or comments, leave them below. We love hearing from you. Until next time, stay healthy and happy.